Good morning, Professor. Myself, Harjinder Singh, and today I'm going to discuss regarding my group topic political advocacy for homeless people in Toronto. So basically, we are three members in our group: Chrislin, Harjinder, and Riza. So today we are going to discuss regarding political actions for homeless people. So firstly, I'm going to discuss the overview of our topic. So as we know, homelessness become an issue of grave concern in past few years in Canada, especially in the region of Toronto. So as a nurses in the community, we start working as a team and we read many research articles to tackle this problem, as well as we collect certain surveys from various voluntary agencies. Then we divided our work equally between all teammates and start finding possible reasons behind this homelessness. And finally, we come up with certain interventions to address these problems, which we will discuss further in our presentation. So, firstly, I'm going to discuss the reasons why we choose this topic for our presentation. So, there are my myriad number of reasons. Firstly, as we know, homeless people are those who are at higher risk of several health diseases, especially as the winter comes and they are going to expose so cold weather and it is really difficult period for them. So in order to protect the homeless people, we choose this topic. Secondly, we know the number of homeless people is raised day by day, which become an issue of grave concern. So even in 2022, the number of homeless people reached to 20,000, which become double in past few years. So that's why we choose this like topic for our presentation. And the third reason is like in order to provide solid solution that inform political practices at the level of government in all sector like health, housing, etc. So here is a survey from past year regarding the homeless people in Canada, which is growing at like high pace. So you see, like in 2021, the number of homeless people is 18,096, which is approximately 20,000. So now I am going to discuss certain interventions to tackle this problem. Firstly, food banks. So as we know, the food is basic necessity for everyone. So by providing proper food banks, it will help to decrease the rate of starvation among homeless population, and it also helps to improve their health to a great extent. So secondly, access to health care. So free access to healthcare is one another important milestone to improve the health of homeless population. So in free healthcare, we provide checkups, screening tests to protect them from several communicable diseases like tuberculosis. And the third most important, health education. So as we know, health education is the basic key to protect homeless people from certain type of diseases and providing so we provide them education regarding adverse effect of drugs and teaching them good health practices that help them to great extent. So fourth, clothing donations. So clothes donation is also help homeless people to protect themselves from extreme harsh weather. Like in clothing donation, we provide them cold wearing clothes, baby supplies, reusable containers, etc. And the last most important, we provide them health counseling. So health counselings are also very important for homeless populations. So as we know, most of the homeless people are those who are addicted to certain harmful drugs, which cause them certain mental disturbance in them. So, but by giving proper counseling to those homeless people, we can help them to avoid these harmful substances. So that's it with my part. So now my another group mate Chrislin going to continue with the further slides. Thank you.
Hello, Professor. My name is Chrislyn. I will discuss the theories, approaches, and frameworks in community work. First, we have the systems theory. So, like every ecosystem, individuals require ongoing input like food, energy, and relationships. in order to survive and hopefully to thrive. When a system's needs are not met, we may feel out of balance, which prompts action. Preserving a state of balance or equilibrium is critical for systems to survive. The next one is the anti-oppressive. So as we know, oppression can be defined as experience of widespread systemic injustice by Dutch on 2011. The next one is anti-racism. So racism is the oppression of a specific racial group, and anti-racism intended to provide equal opportunities for all people. And the next one is cultural humility and cultural safety. So for cultural humility, this is the ability to remain open to learning about other cultures while acknowledging one's own lack of competence and recognizing power dynamics that impact the relationship. And then we have actions to take during implementation. The first one is the intervention will include safe drinking water, accessible showers or hand wash areas, and provide necessary hygiene supplies. The second is frequency of distribution of food in the food banks. The third one is give awareness regarding facilities that are available for them. And the fourth is distribution of clothing in multiple locations. And we have also provide health education programs. Thank you.
So for now, I will discuss the ethical consideration during implementation of this political advocacy. First is the informed consent. So we ensure that the participants are fully informed about the evaluation and they must be aware of the purpose of the activity. Second is the voluntary participation. The participants have freedom not to participate if they don't want to, and it must not be taken against them. Third is do no harm. The evaluation process must not be of harm to the participants, physically or psychologically. The fourth, next one is the confidentiality. The personal identifiable information must not be disclosed or included in the report. Anonymity. The program coordinator must hide the identity of the participants. The last one is only assess relevant components. So we ensure that the program questions are appropriate and must be related only to the activity or program being conducted. So the next topic is health promotion outcomes using the logic model. So our goal is to provide safe food and water, provide activities and opportunities that will help the homeless individuals to develop self-confidence. So the input, the staff, the funding, supplies, materials, hygiene kits, and educational brochures. The activities that we come up with is the food banks, the free clinics, health education, clothing donations, health counseling, and career opportunities. The audience will be the individuals who are homeless. So outputs, the vaccination programs, the mobile screening, the free foods, and the free clothing, and the job fairs. These are the programs that we want to do. Then the next one is the short-term outcomes. The individuals who are homeless will be able to have access to clean and healthy food and clothing. So our long-term outcomes is to reduce the rate for homelessness in Ontario. So that's it for our presentation, and here are our references. So thank you very much for this time. That's all. Thank you.